Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are pleased to be able to join you this afternoon to talk about where we are with all things COVID-19 for the entire state of Maine for today, Thursday, February 25th, 2021. I begin my briefing this afternoon on a sad note. Maine CDC is reporting 24 deaths today and 17 deaths yesterday, all associated with COVID-19. 41 total deaths just in the span of 48 hours. That is a concerning number, with no doubt. But I'd like to note that of those 41 deaths, 39 are the result of our ongoing review of death certificates. As we've talked about, that's a process that we undertake on an ongoing basis where we look at death certificates that have been filed in Maine to determine whether the medical provider who signed the death certificate indicated that COVID-19 was a cause of death. If we find those death certificates, we then compare them against the list of folks that we know who have tested positive for COVID. This helps us ensure that from an epidemiological perspective, we have a clear and accurate understanding of the toll that COVID-19 is taking all across the state. The 39 deaths that I'm noting, in addition to the 2 that have occurred recently, those 39 deaths occurred not in the recent few days, but rather from a longer period of time, from January 26th through mid-February of this year. The vast majority of these 41 deaths were among individuals 60 and over, which is consistent with mortality trends that we have seen across the state throughout the pandemic. That is to say, age being one of the strongest predictors of mortality throughout all different patient groups, a trend that we have seen hold true throughout the pandemic. Sadly, these additional 41 deaths now bring the death toll in Maine associated with COVID-19 to now 701. I'd like to take a moment to acknowledge each and every one of these lives lost. We collectively mourn all of these losses of these valued members of Maine's community. Right now in Maine, there are a total of 44,117 cases of COVID-19, an increase of 217 cases just since yesterday alone. Of those cases, 34,820 are confirmed, 9,297 are probable cases. Cumulatively, 1,521 people have been hospitalized with COVID-19, and just in the last month, 114 people have been hospitalized. Right now in Maine, 67 people are in the hospital with COVID, 22 of whom are in the critical care unit, 8 of whom are on a ventilator. Turning next to some testing metrics. Right now in Maine, the 7-day PCR positivity rate is standing at 1.17%, and our PCR testing volume has gone up to now be at 668 PCR tests being performed for every 100,000 people in Maine. Turning to antigen tests, the 7-day antigen test positivity rate now stands at 3.1%, and approximately 170 antigen tests are being performed for every 100,000 people across the state. Turning next to some updates around vaccines and vaccinations. Let's start with vaccination numbers first. As of this morning, 316,462 doses of COVID-19 vaccine had been administered across the state. Of those, 211,451 were first doses, and 105,011 people have now received both of their doses of either the Pfizer or Moderna vaccines. I also have some updates on what things look like in terms of vaccine supply for next week. We've received confirmation that next week, for the allocation that comes to the Maine Department of Health and Human Services, there will be 16,380 first doses of Pfizer vaccine and 13,700 first doses of Moderna vaccine. This is an increase based on what we got last week. Indeed, it's an increase of about 2,340 doses of Pfizer vaccine alone. The number and volume of Moderna vaccines from last week to this week is holding steady. All told, that is 30,080 new first doses of vaccine that are coming into the state next week. When you add on top of that a separate allocation of vaccine that is being made to retail pharmacy partners, such as Walmart and Walgreens, those partners are receiving roughly 8,600 new first doses next week, separately directly from the federal government. When you roll all of that up, it means that even before the possible J&J vaccine that may or may not be authorized by the US FDA, Maine will be receiving about 38,680 new first doses coming into the state next week. That will be the highest amount of vaccine that will be coming into our state since mid-December, when we first started on this journey around vaccination. One brief note on the J&J vaccine. As we are meeting right now today, there is an expert panel of independent scientists who advise the US FDA, who are also meeting to discuss the data surrounding the J&J vaccine candidate, the vaccine that I discussed at our meeting here on Tuesday. If the US FDA ultimately issues an emergency use authorization for Johnson & Johnson's vaccine candidate, that vaccine could start to arrive in Maine next week. If that happens, we will be ready. And finally, just a few comments about the vaccine landscape overall, because a few things have crystallized just in the last couple of days. Three in particular. Number one, the increase in volume that's coming into our state. Number two, more types of vaccine being seen on the horizon. And number three, and the most important of them, stability. So first, on the volume, we talked about that a second ago. Next week, Maine could be receiving at least 38,680 new first doses. That doesn't even account for the possibility of the J&J vaccine. This will be the highest amount of vaccine that has come into our state since we started on around vaccination efforts. That is a significant step forward, and one that we welcome and one that we're ready for. The second thing that's changed are the possibility of new vaccines. Up until now, we've just had the two, Pfizer and Moderna. But with the possibility of the J&J vaccine being authorized, as well as now other trials for other vaccines, for example, those being made by Oxford and AstraZeneca, as well as another manufacturer called Novavax. With those trials nearing completion and possible submission to the FDA, we now see an expanded and more diversified pool of vaccines on the horizon. Each of these vaccines does better for different vaccinator applications. Some, like the J&J vaccine, are really great in the field. Some, like the Pfizer vaccine, do really well when there's ultra cold freezing units on site. Having that diverse type of vaccine available to us expands the nature and reach of our vaccination efforts in the state. And finally, stability. For the first time, we now have stability in what our projections of vaccine coming into the state look like for not just the next couple of days, but for the next few weeks. The Biden administration, since their first days in office, has pledged to and has in fact worked with states to deliver on the promise of not just expanding vaccine, but also providing state health departments like ours stability in terms of what our projections will be for the next few weeks outward. That, of course, greatly helps with our planning process. With all of this information on hand, expanded volume, expanded types of vaccine, and the stability of all of those projections, we have had, with all of that information, a series of discussions about where we go from here. All of these things, volume, type, and stability, expand the range of options that we have in Maine for where we go next in our vaccination journey. I suspect that Governor Mills will have much more to say about this topic in the very near future. So with that, I'm going to turn things over to our colleagues in the media. And the first question for the afternoon goes to Patty White.
Thanks, Dr. Shah. Now that we're getting about 40,000 doses a week and we have more stability, is the timeline for the rollout speeding up at all? And how many weekly doses do we need to open up eligibility where you could say, for example, this is when teachers will get vaccinated, or this is when people with certain medical conditions can get vaccinated?
Yeah, Patty, I think we've been asking ourselves those same questions internally. And as I've talked about at these meetings, the lack of forecasting around the supply, as well as the lack of supply, have been the impediments to thinking about those issues more carefully and being able to make projections for Maine people that go beyond just the next couple of days or weeks. I think we're at the place now where we have a better sense of both the future of what the near-term future, again, 3 weeks or so of that, what vaccine supply looks like, as well as now seeing the requisite number of doses that expand all of these options. So I think we're at that point now. And again, I suspect that Governor Mills will have a lot more to talk about on this issue very soon.
Okay.
And Dr. Shah,
yeah.
I was going to make a little bit of an announcement, which maybe I'll do now. Sorry. Yep.
I am so sorry, Commissioner. My apologies, everybody. No. I once again, Commissioner, I offer you my apologies. I skipped over that. I'm so sorry about that.
Dr. Shah is very excited about some of the interesting news that he just presented, so he's forgiven. So I am excited to announce that the Maine Department of Health and Human Services is newly offering BinaxNOW COVID-19 rapid antigen test to 1,726 childcare providers in the state. These childcare providers have the capacity to serve 41,792 children. The BinaxNOW tests can detect COVID-19 from a nasal swab sample in about 15 minutes. The test can identify the virus in people with symptoms. Its use can also help preserve the child care workforce, allowing for greater continuity of care for children and the reduction of COVID-19 spread within child care settings. These tests are part of the state's recent purchase of 250,000 BinaxNOW rapid antigen tests. Maine's effort to support child care providers during the COVID-19 pandemic are having a positive effect. In Maine, 93% of child care providers are open statewide, up from a low of just over 50% at the start of the pandemic. Providers have diligently worked to keep children and families safe, resulting in fewer than 10% of all providers having a single positive case of COVID-19 test within their facility since the start of the pandemic. We want to thank all of those child care providers and the Office of Child and Family Services for keeping Maine children safe during this pandemic. And now back to Dr. Shah for questions.
My apologies again to Commissioner and everybody for barreling ahead, but thank you very much, Commissioner. Patty, I'll turn things back to you for questions around the rollout of that testing option or anything else.
Yeah, I actually wanted to ask one more question about something else. The next eligible group will be people 65 and older, and you've said that there's going to be overlap with people who are 70 who still need over 70 who still need the vaccine. What's going to be done to make sure those people don't fall through the cracks once eligibility expands? Will they get priority when they sign up for the vaccine?
Eddie, we've as we've talked about, it is a series of dials. As we turn up the dial on other categories of individuals who can soon be vaccinated, we know that there are remaining individuals in the 70 and over category, to say nothing of others that will still be looking for vaccine slots. I think there's a few things that we are working on to make sure that they are able to access a vaccine. The first is we know that, for example, for the 70 and over category, being able to schedule an appointment is not easy. And we recognize that, and we've certainly heard that throughout. So we've been, for example, working with area agencies on aging, to say nothing of other groups out there, to help those Maine people 70 and over navigate and find an appointment and actually get scheduled. We're also simultaneously working with other groups across the state who work with seniors to make sure that they know how they can help other people get vaccine and get access to it. So we know that there will still be that challenge, but as vaccine supply opens up, we also hope that finding a spot will not be the challenge that it has been up until now.
And
Okay,
I
thank
will
you.
add that while we feel strongly that our providers vaccinate the people who are currently eligible, we also do allow within those eligibility categories that kind of prioritization for medically underserved, hard to reach populations, people in medically underserved communities, people on the Umbridge Islands, people in tribal communities. So that has always been a priority from the start. We take our equity role very seriously, and we have developed a bunch of innovative partnerships to do so. We will increase that effort to try to, as again, vaccine availability becomes more widespread. Think of how do we get to homebound seniors? How do we do pop-up clinics in places like Bridgeton, which we did recently? And how do we ensure that if there are people who just struggle to get there, we get to them? So that is ongoing work that will not end.
Thank you.
Thanks, Patty. Let me turn it over to Mal Meyer next.
All right, thank you so much, Dr. Shah, for taking my question. What is the state doing to ensure areas with lower vaccination rates are keeping pace with other regions, especially in places like York County that have seen higher rates of infection but have had lower vaccination rates, especially compared to surrounding counties like Cumberland County?
Sure, Mal. I'm glad you raised that because that's a topic that we've been discussing. Commissioner Lambrew and I have discussed it at length, over the past couple of weeks. The data that we look at, Mal, and the way that we are analyzing this question is for any given county, what percentage at present of the population in that county that is age 70 and over, what percentage of that 70 and over population has received at least their first dose? And when we take a look at those data, we see that certain counties are doing quite well. For example, Saginaw, Cumberland County. But there are other counties where we are focusing the efforts, which I'll talk about in a moment. For example, Somerset County, Kennebec County, Oxford County, Washington County, Androscoggin County. Those are all areas of the state where fewer than 50% of people 70 and over have received their first dose. So those are areas of where we are working very intensely to do a few things. The first is make sure that when we are providing vaccine, that providers in those areas are getting what they need to get vaccine out the door into people's arms. The other is working with local stakeholders there. For example, whether it's the county EMAs, county emergency management agencies, who we have started speaking with in those counties to explore whether there might be options for additional vaccination sites that we haven't thought of to expand access, as well as healthcare providers in those areas to make sure that they have all the facts around the vaccine so they can talk to their patients about it. We know that those counties in particular, the ones that I mentioned, Somerset, Kennebec, Oxford, Washington, Androscoggin, those are areas that we have really been paying a lot of attention and focus. Commissioner, did I miss anything on your end? Transportation is also an issue, but there's a host of things.
Yeah, I would only add that again, as you mentioned at the top, we have potentially new opportunities for vaccination with new vaccines coming online. So because of the observation period for the Pfizer vaccine and Moderna, there's been a reluctance here to do drive-through vaccination because can you really effectively monitor somebody who's in a parking lot? That could change with the J&J vaccine approval. That's one good example of a way that a new vaccine with a different type of usage could mean drive-through clinics throughout Maine, which would be, I think, a real plus for some of our more remote areas.
And then my second question, my apologies. Earlier today, Massachusetts Governor Charlie Baker announced loosening of restrictions, especially for sports arenas. Do you know when Maine might make a decision for similar facilities, specifically Hadlock Field?
Yeah, we are in active review of all of our protocols, including some of the ones that you just mentioned. You know, we have seen in the past 2 incubation periods, 4 weeks of fairly significant decline in COVID-19 spread. All that said, we're keeping an eye on the variant, so we do continue to monitor our trends. But in light of the recent trends, we are doing a comprehensive review because we do know that businesses do need to plan. So those reviews are underway, and hopefully Governor Mills will have something to say about that soon.
Thanks, Mel. I'm going to turn to Morgan at WABI next.
Hi, Dr. Shah. My question today is about open spots, appointments at clinics like here at the Cross Center. Where there's open spots there, and there are people who are in, let's say the 65 to 69 bracket, or people with pre-existing medical conditions, would it be possible for those people to have those slots? As these days go by, I think we're getting, response from viewers who are seeing these open slots. They would like to go take these slots. They're seeing these days go by with these slots open and available. Is there anything that could be possibly done in the future to help with that?
The short answer, Morgan, is yes. I think as we've alluded to, now with more stability in knowing what the supply of vaccine coming into the state will be, as well as increases that have been happening, we now have a better sense of what the near-term future looks like with respect to vaccine supply, and thus things like planning around larger scale sites and when they may be able to offer slots to other people. I think, again, all of those things are pointing us toward that direction. We've been in active discussions, taking a look at all of these things, and I expect, again, the governor will have more to say about that soon. One important note. Well, yeah, I think that's where we are right now.
Yeah, I will just make the point clear though. Well, that is the future. Today we are in that 70-year and older eligibility category. So we do appreciate that there are people who are in other categories who are, eager to get a vaccine. We are eager for them to get a vaccine as well, but they are not yet eligible. So those people cannot call Cross Insurance Center today to get those appointments.
But maybe soon?
Maybe soon.
Maybe.
And another question is about distribution and how the vaccine, the supply has been determined in the past, going out to different counties, different clinics, and how you'll be with the new supply coming in, how you determine that.
Sure. There's two quick things to say there. One is the possible availability in the near future of the J&J vaccine, because the J&J vaccine opens up new avenues of vaccination. As Commissioner Lambrew noted a moment ago, it doesn't so much replace existing vaccine, it opens up new methods of reaching Maine people and offering them vaccine, whether it's a drive-through or whether it's better ways to reach homebound Mainers, things of that nature. So the availability of the J&J vaccine opens up those possibilities of how we can deploy it really effectively out in the field. But generally speaking, we look at a number of factors as we are thinking about how and where a vaccine needs to go. Some of it are facility-specific factors, such as how many folks are scheduled, how much vaccine do they have on hand, what are they looking at in terms of operation? If they're looking to open up more slots, for example, then that's something we can allocate for. That's one set of factors. Others are epidemiological factors. I mentioned a couple of a moment ago. One of the ones that we look at right now very intensely is the percentage of people in the age bracket that we're focused on, 70 and over, in each of the counties who have received their first shot. We see when we take a look at those data that, for example, 74, 75%, 76% of people in Sagadahoc, Cumberland, and Lincoln County who are 70 and over have received their first shot. But we see disparities at the other end of the table. We take that into account as we are trying to determine where to focus those efforts. I'm going to turn now over to Amy Brown.
Thank you, Dr. Shah, Commissioner Lambrew. First, just quickly, when do you think we'll be getting this announcement from the governor that you've both been implying may be coming soon?
Soon. I can't give any more details than that.
Okay, so not like this afternoon, probably.
I do not believe it's this afternoon.
Okay. Is the Jackson lab monitoring for all of the variants, including the one that's in the news today a lot from that's been discovered in New York? And are the samples that are analyzed for variants, are they selected at random, or does the CDC or DHHS or whoever makes those decisions perhaps select some from an area of concern to be checked? How does that process work?
So, Amy, the process of conducting genetic sequencing on any particular viral sample is quite extensive. And what it involves is essentially taking the virus, breaking down its DNA, and then doing a catalog of every single piece of that DNA, which is a very extensive process. It involves a lot of computational power. And when that sequence has been divined, it's when it's been completely categorized, they compare that against a library of every other known sequence from viral samples from around the world. It's a little bit like, so it differs from PCR testing, diagnostic testing that we've talked so much about. Diagnostic testing is a yes or no question. Is there coronavirus in this sample? Genetic sequencing is a lot different. It is saying, if this sample, what does it look most like? In my own mind, here's how I think about it. PCR testing is like handing someone a piece of fruit and saying, is this a banana or not? Yes or no. Pretty straightforward. Genetic sequencing is a lot harder. Genetic sequencing is like handing someone a banana and then asking them to walk around a grocery store with thousands of bananas to figure out whether the banana that you've handed them closely resembles any other banana in there. It takes a lot of effort, takes a lot of computational power, because you're matching every single thing up with another exemplar in a library. So that's why it's not so much is this a variant? It's which of the thousands of variants that have been characterized does this particular sample most closely resemble? The way that we go about selecting those involves multiple steps. We try to find a geographic diversity across the state. Jackson Laboratory, as well as the US CDC, apply their own criteria to ensure that we're getting an accurate sample from across the state.
Okay, and what percentage, I know you've mentioned this before, but I just want to make sure I have it right. The percentage of cases are selected for samples to be checked for variants?
I'll have to check. We are, the last time I looked at this, we were in the #2 spot in the nation, just a shade behind Hawaii in terms of the percentage of samples that we were sending for sequencing. I'll have to check to see what that stands at today. The last time I looked at those numbers was about a week ago in terms of the overall numbers. We get reports every day of the variant analysis, but in terms of the overall percentages and how that stacks up against daily positives, we'll check and I'll get back to you.
Okay, and can I ask a question from a listener quickly?
Sure.
Follow up. Okay, they ask about New Hampshire. The way they're doing it is in phase 2B, they are including people ages 50 to 64, but Maine has obviously made the decision to include those folks in with the general population, and they're wondering why Maine made that decision, since people in their 60s and even some in their 50s have had higher rates of death than younger people.
Mm-hmm. I think one immediate and relevant difference is the significantly, well, in Maine at least, the very high portion of our population that is 70 and over. 193,000 people across the state who are just in that 70 and over category. When we started down this vaccination journey with people who are not healthcare workers, we wanted to make sure we put some guardrails around that. So those individuals 70 and older who are at the highest medical risk of disease or severe consequences from COVID could make sure that they access vaccine rather than opening it up more broadly. But as we've discussed, Amy, as the vaccine supply has been increasing and the stability of that supply is increasing, we are determining where to go from here.
Thank you.
Mm-hmm. Let me turn to Dustin from New England Cable News next.
I have Walgreens questions for you, Dr. Shah. The first is, how is the rollout there going today, from what you've heard?
From my perspective, it's going well. There are, again, 47 Walgreens locations across the state of Maine that are now offering COVID vaccinations. We've heard some things that we've taken back to Walgreens to make sure that they were addressing, and they have done so. And generally speaking, the emails that I've seen, The reports that I've seen on social media have suggested that folks have found that option to be viable. They like the fact that the Walgreens that they may be able to get their vaccine from is in their neighborhood. It's a place they know, it's a place they trust. So we very much value the partnership with our colleagues at Walgreens.
You mentioned how many stores, how many shots a week is this going to be at the beginning? I know this is something you may have touched on in the past. Do you have an estimate of how many shots it's going to be?
Yes, Walgreens was allocated from the federal supply, not from the state of Maine supply, 4,680 doses of Pfizer vaccine for their location, their 47 locations, which we worked with them to identify across the state. That was for this current week. For next week, I'll have to check, Dustin, and let you know what it is. We understand that it might be a slight increase, but certainly still keeping at that 4,680 level, maybe just a shade above that.
Following up on one of your answers to the first question, what were some of the things that people have written you about how things are going?
We've received favorable reports from folks across the state. I've gotten them, our communications team has, and I've just seen another on social media, the favorable reports both for Walmart and Walgreens, both. The efficiency of the process is something that folks have liked. The fact that it's a neighborhood location, a place that they were otherwise going to pick up other prescriptions or other household goods was something they found favorable. The ease of being able to sign up on a website that they knew that they were already familiar with was also favorable. And in some instances, for a lot of folks, being able to know and go to a pharmacist that they've worked with for years, who's been otherwise involved in their healthcare, that's been a benefit for them as well. From our side, ease of administration and the throughput that those stores can achieve means that by selecting those partners, we can get a lot of Maine people vaccinated in a short order of time.
That was my last question. What's the impact? How would you categorize that? Is there a certain word you would use to describe how much of an impact this is going to have on the vaccine plan?
Yep, access is the impact. Among the reasons, and Commissioner, please weigh in, but among the reasons we are working with Walmart and Walgreens is the geographic breadth of where their locations are across the state of Maine. Places that are harder to reach, places that we know vulnerable folks live, and venues that we know that folks trust. So in a word, I'd summarize both as access.
Yeah, and just to give you one example, we really were struggling with Oxford County, but the Walgreens in Oxford County by themselves, without additional sites, bring us a long way towards our goal of vaccinating sufficient people in Oxford County, given its population size. It really, for those remote areas, has been especially welcome, and we look forward to additional pharmacies being able to come online, including Hannaford's and maybe CVS. Other pharmacies have some of that reach as well. So we do continue to look to broaden out those partnerships, hopefully with extra doses from the federal government over and above what we get.
Exactly. Thanks, Dustin. Let me turn it over to Kevin Miller from the Press Herald next.
Hi, great. Thank you, Dr. Shah. Following up on the question about kind of the disparities, I mean, we still are seeing lower numbers in York County when we consider, the higher infection rates in York County. Can you just update us on where things stand with the Sanford mass vaccination clinic? What's the schedule for that?
Sure. Well, let's start with the numbers first, Kevin. York County is sort of in the middle of the pack when you look at the metric that we've been really zeroed in on, which is the percentage of those 70 and over within that county who have received their first shot. York County stands at 54.5% of people there 70 and over who have received their first shot. Certainly not where we would want it to be. And so we are working, as you noted, to bring online more vaccine access in York County. One such move is the opening of a large-scale vaccination site in Sanford. That site's slated to open next week. I know that there are finishing touches that are being made. We'll have a lot more to announce on that once all of those touches are ready to go, but early next week is where we're focused.
Great. And Also, it seems like there's been a disconnect somewhat between the supply of doses. At least we're seeing a disconnect between the supply of doses that are going to Maine Health, especially for the Sanford clinic, mass vaccination clinic. They're suggesting they have the capacity at Scarborough Downs, but don't have the vaccine. You seem to be suggesting in one of conversations with one of my colleagues that it was more of an issue of their lack of capacity to administer the doses. Can you elaborate, either you or the commissioner, elaborate on kind of what's going on there, and why are you seeing, what you're seeing at Scarborough Downs are they not doing enough from your perspective to merit getting more doses?
I'll start, and then Commissioner, please weigh in. You know, we've had, since the beginning of the pandemic, we have had nothing but a productive relationship with our colleagues at Maine Health, whether it was around testing, patient management, and now in mass vaccination. And we have worked really closely with them to, right now, again, make vaccines available to as many Maine people as possible across the state. To the point that you noted, Kevin, when among the various metrics that we look at, when we're looking at where to allocate vaccine to, we take into account so many different factors. We've just talked about one of them, which is percentage of folks 70 and over, but there are numerous other factors as well. The bottom line here is that we all share the same goal, which is to get Maine people vaccinated as quickly as possible. We all wish that there weren't these supply constraints. As the commissioner and I have noted today, those supply constraints are easing with each passing week. And as that happens, we'll be able to equip vaccination sites across the state with more and more doses. All of this is in service of one goal statewide, which is to get as many shots into arms as quickly as possible. And we all share that goal uniformly.
And just a quick follow-up, the J&J vaccine, if and when that does come, do you think that might be a good option for sending it to some of these smaller practices, the independent practitioners, the primary care physicians, because it is more shelf stable and they can do home visits, things like that?
It opens up that possibility. It opens up a number of possibilities. For example, it opens up the possibility of equipping, for example, EMS clinicians who are going into the field for different types of congregate living, whether that's independent living or other types of congregate settings. It equips or opens up the possibility of true drive-through vaccination, whereas right now it's more come inside somewhere because of the need for an observation period. And then perhaps further down the road, it opens up the possibility of working with, for example, independent medical providers to equip them so that vaccinations can be given in the office setting as well. All of those things are made possible because of the J&J vaccine. As the supply increases of that vaccine, we can move further and further into those options.
Great, thank you.
Let me turn it over to Jessica at the BDN next.
Thank you, Dr. Shah. First, following up on the J&J vaccine, does Maine have any sense of how many vaccines it might receive at the outset once that, if that vaccine is approved, and is that tied in any way to when the state might expand eligibility?
So Jessica, we haven't received final confirmation of what the values of J&J vaccine coming into the state would be. Again, right now, our focus is on waiting for potentially the emergency use authorization. If the US FDA authorizes the vaccine, then we'll be ready to take whatever allocation we get and get it into arms. There have been some national estimates for what the production looks like that is ready to go and start to be delivered. We're basing some of our planning off of those national estimates. If the emergency use authorization is granted, we understand that there will be a confirmation or a lock on the number of doses coming to Maine. Up until then, what we've been doing is basing our planning off of some of those national estimates adjusted for Maine's population.
And based on those national estimates, like what's a ballpark? Are we talking 1,000 vaccines or 10,000?
I really don't want to speculate, Jessica, because until we know exactly what is on the shelf ready to go and what that means for Maine, it's just really hard to say.
Okay.
I just don't want to speculate until there's a little padlock icon in the dashboard that we share with the US CDC and Operation Warp Speed, indicating that the allocation is locked. It's quite subject to change. But to your prior point, though, the availability, the option, the availability of the J&J vaccine potentially, if the EUA is authorized, does help us move further down the path. That has been it's been an element of our discussions around where we go. And again, I suspect the governor will have more to say about this very soon.
All right. And then you talked a little bit earlier about allocating to different parts of the state based on the percent of people eligible over 70. I was wondering if the state is also analyzing provider throughput at all as part of how it's considering those allocations, and how that might be a consideration.
It's a big consideration. Commissioner Lambrew and I have said on multiple occasions, throughput is a very important factor. We take a look a couple of times a week. Let me take a step back. A really important element in our vaccine, or our entire vaccine architecture, is the movement of doses within the state. Every week we publish a list of where vaccines are going. But those vaccines, when they arrive in Maine, they only arrive at their first destination. Throughout the week, we take a look at what's being used and where there are more people who are slated but without the vaccine. And we move that around. So what you see us publish every Thursday is the first stop for vaccines in Maine, not the final destination. Because from the time we receive it to the time it ultimately goes into arms, we may be moving it around the state. And one of the factors that we use to move vaccine around the state is the day-to-day throughput as a function of what's scheduled. And again, if we see places that have scheduled folks on hand and the ability to do more, we'll move vaccine from another place that might not have everyone fully scheduled. That's one reason Maine has been able to achieve good throughput since the first days of the vaccination process. So throughput definitely matters, and we monitor it on an ongoing basis throughout the week. Let me turn over to Allison Ross next.
Hi, Dr. Shah. Thanks so much for taking my question today. So down in Massachusetts, they're reporting that their system did not crash. It was just overrun with thousands of people trying to sign up for a vaccine. So it may seem counterintuitive, but has the state considered opening up the vaccine to smaller, more specific groups so that it doesn't clog up the system like they saw?
We've considered it, but Allison, our approach to date has been to try to, it's very difficult to open up a system, a publicly accessible system, to just certain groups of the population and only cordon off access to those groups, especially in this day and age where forwarding a link or texting somebody the URL is really easy to do. So our approach has really been to think big. I mean, that's what mass vaccination is all about. It's swaths of the population that we want to afford access to rather than thinking small.
Right. And then today we're seeing over 200 cases. This is something that we saw for weeks and weeks, but a few days ago we were seeing under 100. Is there anything we can correlate this number to? Any big events?
No big events that are directly tied. There is, even within a downturn of cases, which is thankful, there's always a little bit of natural ebb and flow. It's too early to predict whether this means anything. This could be a blip. It could be the beginning of a different trend. But as of right now, Allison, we have not tethered it to a particular event, or nor have our case investigators identified these cases as being directly or imminently associated with a gathering or an outbreak.
Great, thanks.
And I would be remiss if I didn't use that as just a quick reminder to folks that we're not out of this yet. Although we talk about vaccinations and we talk about the fact that cases have come down, hospitalizations have come down, positivity rates have come down, deaths have come down, outbreaks in long-term care facilities have come down, we're still in this. We still have to be vigilant. And the final question for the afternoon goes to Chris Costa at News Center.
Hi, Dr. Shah, Commissioner Lambrew, thanks so much for taking my questions. A quick question on Walgreens, kind of following up. We had some viewers contacting us who were a little bit concerned about the sign-up process. There was concern that there were some people who were able to sign up for a Walgreens vaccine appointment and may not necessarily go through the proper vetting to make sure that they are eligible currently under Maine's phased approach. Have you had any reports of this? And is there anything the Maine CDC can do about this?
We have had one or two reports of that. I referenced earlier in connection with Dustin's question, some concerns that have been raised to us. We've immediately flipped those over to Walgreens and asked them to address them. Some of them were related to the fact that early on their website included more categories than were currently eligible in Maine. And so we immediately notified them of that. They acknowledged that concern and we're working to fix the website. So that's sort of how we handle that process on our end, Chris.
Did Walgreens give you any indication as to how they would go about fixing that?
No, I think it was just amending the website to make certain categories that were not eligible in Maine, removing those from their website.
Okay, understood. Thank you. And then
Great.
The other question I had for you too was about people in phase 1A who have still not yet been able to get vaccinated. I don't know if the state is looking into that at all, if there's a plan for it. I think for one example, one issue we're hearing, and this is a very specific example, so please pardon me, but there are some corrections officers at jails across the state who say, I've called, I've pre-registered, I'm waiting for that confirmation call back, but unfortunately, while I'm working, I can't use my cell phone and therefore can't set up the appointment. Is there a way that the state can ensure that the people in phase 1A who are considered those most frontline or critical, pardon the term, make sure they still get vaccinated if they want to?
Sure, Chris, I think you cut out a bit, but I heard you reference some men and women at county jails.
Yes, that's correct. Corrections officers who said they were having a tough time finalizing the appointment process.
Got it. We've had discussions about that. Commissioner, I'm happy to start unless you want to jump in around that. But bottom line there, Chris, is that we recognize that even as we move across the phases, there will be still folks in earlier phases, in this case 1A, who may not have yet been vaccinated, either because on the day that the vaccine clinic was offered to them, they weren't able to be there, myriad reasons why that might be the case. We've worked with, in particular, reference to the county jail, we've worked with the Maine Department of Corrections. Indeed, we check in with them every single day and made sure that that process was something that they were talking with jails about. Big picture, the process to vaccinate corrections officers at the jail level was something that we at Maine CDC and DHHS worked in partnership with the Department of Corrections on. So that process was one that came down to the jails in partnership with the Department of Corrections. They received their vaccine from DOC. And so we've been working with DOC directly to make sure that those corrections officers still have access to vaccine. So thanks, Chris. Commissioner, I'll turn things back over to you if there's anything you want to recap for the afternoon.
No, I will just say that going back to Walgreens though, we did check the website. That's what we do when we hear problems, and those extra eligibility categories were removed. So that is one problem solved. And I would just say in the bigger picture, we do continue to focus on what's next. What did we learn from this past week, but what can we do going forward? Again, with a significant increase in vaccine doses next week, more than we've gotten in any week since the pandemic began, those opportunities are great. Thank you, Dr. Shah.
Thank you, Commissioner. Again, my apologies earlier, but thank you all for hopping on this afternoon. We appreciate you taking a little bit of time out of your afternoon to get up to speed on where we stand with COVID-19. We look forward to chatting with everybody, certainly on Tuesday, if not sooner. In the meantime, as always, please be kind and take care of one another. We will talk again soon. Thank you all.